Cardiac tamponade. It's associated with this thing called Pulsus Paradoxus, and that's where you have a decrease in the amplitude of the systolic blood pressure by greater than 10 millimeters mercury. So let's do this quick question here. We are going to have a 60-year-old man with metastatic lung cancer presenting with hypotension, jugular venous distension, and muffled heart sounds. That is Beck's triad. All right, and yeah, his systolic blood pressure is going to drop by 18. Oh my goodness, Pulsus Paradoxus. And what is going to be happening here? It's going to be the compression of the heart, limiting ventricular filling. So that's cardiac tamponade's going to be the heart to squeeze by the fluid. So when the right side fills up during inspiration, it squishes the left. Normally it's not a problem, but when the heart is squished as it is, it's going to be a problem. And so it's going to be a blood pressure drop of over 10 caused by the heart being squeezed, the right heart stealing space from the left, and it's going to say move on over, and it's seen in tamponade, also asthma, and pericarditis and croup, and it can cause the pulse to just disappear when you're breathing in. The pulse is gone. All right, so it's seen in asthma and croup. That's like kids with the barking cough, and you inhale, the right heart is going to swell, and the left heart gets squished. That's pretty much what happens. It's kind of all there is to it. Yeah, you just suck more blood into the right side. It's like a vacuum. You pull it in because your lungs are expanding and the chest pressure is going to drop. And so the heart still pumps. That's like normally what happens. But in the cardiac tamponade, you have way too much fluid. It's just the water balloon thing we talked about in the last video. And the right ventricle cannot stretch outward. It can try, but it can't. And the fluid is squeezing it in. And so if it fills up more during inspiration, then it'll bulge into the left ventricle space. Okay? And so yeah, that's pretty much all there is to know about this weird thing. But another little practice question you might see here, I'll paste it. It's a 55-year-old man with metastatic breast cancer and a shortness of breath. So we'll go to this question. And he's got discomfort and lightheadedness. It's going to have a physical exam where he has muffled heart sounds inside of neck veins. You're always going to see that Beck's triad thing. Is it going to be this swinging heart? No, that's the alternating electronans causing the QRS changes. No, it's going to be this drop of the pressure. So that's going to be cardiac tamponade, too much fluid pressure. When you breathe in, it's on the right side. There's no room to expand. And so that's just going to be the best explanation for these findings in particular. We had another question where we talked about these other conditions, but yeah, that's pretty much all there is to it. Yeah, just telling the right ventricle, move on over, buddy. And it'll squish it over, and there's less room to work, and so the blood pressure will drop when you're breathing in. See you in the next video.